According to the American Cancer Society, 20% of all cancers and 80% of all lung cancers in the United States are caused by smoking. This is just one of the many harmful effects of smoking cigarettes. Tens of millions of adults in America smoke cigarettes regularly, and it's highly likely that you as a viewer could be one of them. My family members in the past that have smoked have experienced many harmful effects, and most of them are similar to these main three. Three big effects that I want to discuss are effects on lung function and lung capacity, as well as effects on dental implant stability and effects on cancer treatment symptom burden. First, let's focus on where the smoke resides in the body by analyzing the effects on lung function. Before I present a study that analyzed this effect, allow me to define what FEV1 is. FEV1 represents the proportion of a person's vital capacity that they are able to expire in the first second of forced expiration to the full forced vital capacity. Basically, FEV1 refers to lung capacity, and it refers to air being expelled from the lungs. Now, let's look at the study that was conducted by Busselton Health Surveys, which found that at the age of 19 years, FEV1 was reduced in subjects with asthma, but was similar in smokers and non-smokers. Males, taller subjects, smokers, and subjects with asthma had higher declines in FEV1 with age. Now let's analyze two diagrams that were from this study. On the left here, we have males, and on the right here, we have females. As you can see, asthmatic smokers had the greatest decline for both males and females, and smokers had a greater decline than non-smokers and non-asthmatic non-smokers. Now, let's move on to where tobacco actually enters your body by analyzing the mouth region, and more specifically, dental implant stability. Based on a study by the Department of Oral Surgery and the Medical University of Warsaw, Poland, this study indicates that smoking cigarettes has a negative effect on the stability of immediate implants in the maxilla. And if you don't know what the maxilla is, that is the bone region of your mouth that is basically your upper jaw. Results also showed that tobacco significantly affects the biology of periodontal tissues and contributes to increased risks of periodontal implant disease. Now let's analyze a diagram from this study. As we can see by the line on the bottom that represents non-smokers and the line on the top that represents smokers, smokers had a greater decline in tooth mobility, or they had a more exaggerated effect of tooth mobility, which shows that the implants were less stable. As for the implant stability quotient, we see that smokers had a lower implant stability quotient, which represents that the implants were less stable. Lastly, an effect that's related to the most well-known effect of smoking, which is cancer, we have the effects on cancer treatment symptom burden. Before I analyze this effect, let me explain the relation to smoking and cancer. For a long time, it's been known that smoking cigarettes can contribute to multiple different types of cancer, especially lung cancer, throat cancer. Many different types of cancer have been known to be caused by smoking or influenced by smoking. Treating cancer can cause what's known as symptom burden. This refers to the physiological burden that is placed on a patient through their perception of their symptoms. Basically, when a patient has very severe symptoms, it can actually bring about physiological symptoms that are not necessarily related to the treatment of the cancer. Now, let's analyze a study by the University of Rochester in New York, which found that smoking was associated with an increased symptom burden during and following treatments of cancer. And the table of results shows that non-smoker cancer patients versus smoker cancer patients had much higher cancer treatment symptom burden in almost all of the different categories for different types of symptom burden. To conclude, smoking negatively affects lung function, it decreases dental implant stability, and it increases the amount of cancer treatment symptom burden. As presented by a quote by the American author Fletcher Nebel, smoking is the leading cause of statistics. Thank you for watching my presentation.